So if I was starting a program, pharmacy tech program from scratch, number one is that you need to have, there's a certain mature student. They don't have to be perfect. They don't have to have straight A's or anything like that. I have plenty of students that have B's and C's in some of their other classes, but it's important that they are mature, emotionally mature, and you are around controlled substances. So that being around controlled substances, of course, and then you have to do the drug screenings and all that kind of stuff for your clinical sites. So our kids start out sophomore year, and they take principles of health science, and then junior year they take med-term. That's when we start rotations. So they job shadow during their junior year, and then they have to be recommended for the pharmacy tech program. So the students have been kind of vetted out for the past 2 years before they arrive in the pharmacy tech program. So if I was starting a program, I would maybe try to get 14, 16, 18 students, something like that. If you're at a small school, the numbers might be smaller. And I would begin, go to my 4 or 5, start small, try to get just 4 or 5 pharmacies on board for clinicals. Once you go ahead and get the students, do the training, the 6 weeks, and then maybe send, if you have 4 sites, send your best 4 kids out. They will help open doors so that you can get more sites, because I always ask if I can use the pharmacist's name and phone number, and then I make a list. And so I'm able to show a new pharmacy, here is the list of pharmacies where we are welcome, so for rotations. And so here is a list of numbers that you can call if you want to find out about our program. And so they can always, it's a small world in the world of pharmacy in these towns. And so pharmacists can talk to other pharmacists to see, how the rotation program is going. And that's the way that I have gotten additional sites. So maybe the second year, maybe you try to get 8 to 10 pharmacies on board. So basically you just start and hopefully maybe rotate those number. If there's 4 sites and you have 12 kids, so maybe 4 go out at a time. Maybe they can do a rotation after school. That's another option. And so maybe we could get 8 different slots out of 4 pharmacies. So, and eventually, hopefully, if they have their tech training license with the state board, then they can get an afternoon job after school or on the weekends. And then you just keep building and building from there. So in the retail pharmacy setting or hospital pharmacy setting, the controlled substances are there. So you definitely want a mature student. They don't have to have straight A's. I have many students that have B's and C's in other classes, but you just want an emotionally mature student. So we vet our kids through sophomore year and junior year. So pharmacy tech is their senior year, and they have to be recommended for the program from their junior year teacher. And we do start getting out into the clinical environment junior year. So students wear scrubs and shadow healthcare professionals. And then they decide senior year if they want to be part of the pharmacy or CNA program, but they do have to be recommended by their junior level teacher.
So in the programs that we've launched this year, the single greatest factor, and this is really true of any year, is finding the right teacher. You have to find someone who's passionate, who's also knowledgeable. For us, our target population are high school dropouts. So we do a lot better when we find somebody that has worked in the field for at least 5 years, if not longer. Somebody who can tell stories, somebody who's been there and done that. Then the next thing is to make sure, and this is largely my responsibility, is to make sure that they have the equipment and the resources to do the training. I cannot leave them out there without having a chair to draw blood and ask them to do phlebotomy. So I've got to make sure those materials are there. I have to make sure that the needles are there, the syringes, the swabs. Those things, if you think about those after the fact, it's too late. I can remember being a teacher in my first year or two, being asked to work with young people and not having the resources. So we go ahead and we stock the room as we're looking for a teacher. The other thing has been to work with NHA and have the salespeople work directly with the teachers so that they understand, what does the printed study guide do versus the online curriculum? What about the tests? How do you use those as practice tests versus the actual exam? Those are some of the things that we really needed to put in place, make sure that there was a comfort level for those teachers. And then initially, we started with smaller groups of those students who were the most interested in becoming nurses or phlebotomists. It's really hard to teach somebody who says, I think I might want to go into this, or maybe construction. It's too hard to really tie into their hopes and dreams. So in the beginning, if you find young people that definitely want to go into healthcare, they're much more motivated, and it makes the teacher's first experience a lot easier. And that goes for virtual or in person.
So in the new COVID year, August of 2020, Pima JTED started their new comprehensive healthcare program, which is a multi-level certification program for our juniors and seniors in high school. Students can leave with phlebotomy, EKG, and electronic health record certification. Were we crazy? Yeah. Was it needed? Yeah. So we decided to roll this program out. My first step was, after I rolled it out, is who do I get to teach something so multi-level in certification and keep kids engaged and get them through, knowing we were living through a pandemic. And we found an incredible educator who was able to come in and begin to build a program. So between the two of us, we found an interactive learning management system, educational system for our students that can be delivered either in a virtual world or can be delivered in a blended curriculum world. And we've been able to adapt that program for the students to be able to move through it smoothly and efficiently. And when we do go back into hybrid, the students then will begin to practice their skills, which they have been doing some of that virtually, very basic skills, nothing invasive. And kind of the advantage of starting a program like this is having the time to be able to really monitor the program and watch how the students are growing and flourishing in a very controlled environment, which in a normal year you wouldn't have that because you're going back into the classroom. Whereas this instructor has been able to really concentrate her energy on developing this program in a very controlled environment and being successful at it. And then not to mention NHA and all their supportive materials, their test prep materials that are assisting us in modeling what the students need to know and learn to be successful in completing the certification exam. So we really won't know. The proof will be in the pudding when the students do go take their certification exam. But from what I am seeing, we have retained our students. We have kept them engaged. Of course, it's a very interesting curriculum, very interactive, and I think because of that, that has kept the students in the saddle and continuing to learn and grow. And actually next year, because of the success this year, we are adding another cohort of comprehensive healthcare tech on one of our other campuses, and we will be able to offer it across our county for all our young people who are interested in those types of certifications. Now, why did I choose comprehensive healthcare tech? Well, it's needed. Our community partners spoke to us. They're like, we need phlebotomists, we need EKG technicians, we need people who can work in the electronic health record system. So, it was an awkward time to do something like this, but actually has become very successful, and I'm very excited to see where these young people grow. Our seniors, of course, will graduate and go into industry and then potentially post-secondary. And our juniors have an opportunity to take another senior pathway to gain additional certifications. So we are going to have a population of young people who have multiple certifications and multiple job opportunities in any one healthcare arena. So it's been very exciting to see it evolve.
With the restrictions of the pandemic, the single greatest problem that we've run into is having enough people in the school to volunteer for the students to practice their sticks. A lot of the students opt out to stay home and do all their education virtually. We even have teachers that have opted out of coming in and do all of their instructions. So before the pandemic, we might have 300, 350 people in our school that we can practice blood draws, not just including the students in the class. Now, sometimes those numbers are so low, and often they're the same people, that after the first stick or two, they don't want to volunteer anymore. So that's been the biggest hurdle we've had to overcome. And what we've found is that the impact hasn't been an inability to do it, but our phlebotomy class has had to last longer just so we could get the necessary sticks in.
The first challenge was, were we going to get enough students? Were there going to be enough students that wanted to participate in a new program during COVID? The second challenge was, could we find the right personnel to assist us, the right educator to make this program successful? The third challenge was, what type of didactic or curriculum were we going to use to ensure that in a virtual world, the students would be engaged? And fourthly, bringing that all together and implementing it. And we were very lucky that we were able to do that pretty smoothly due to the individual we hired, due to the resources we were able to find, and then the support of our partners, both in the community, business, healthcare, and then educational. So using all those individuals and resources, we were able to roll out this program pretty successfully. I'm not going to say that there aren't going to be changes or new challenges that we're going to have to look at as we move towards the end of the school year and when we move into the new year. But for the first year, the registration was well, we had a great instructor, and we had an incredible educational platform, and then the assistance of test prep materials through NHA are really assisting us in the success of our students.
So my biggest advice, if you're going to be starting a new program, you're entering into a program that's existing, and you're a new teacher and they're saying, welcome aboard, or if you're starting a new program and they want you to set it up. My biggest thing first is community partnerships. Getting your community on board with you about what this program's about is vital. If you are a clinical program and you need to send students out to sites, community partnerships are the best thing that you can have on your side. And that is hitting the pavement, talking to people at sites, introducing yourself, and getting them excited about high school students coming into their facility, into their clinic. It's one of our hospitals here has a great saying, grow your own. And I'm a firm believer in that. If we don't start educating our young now and getting them excited about these things, they are going to be taking care of us in the future.
So when I started out teaching this program about 7 years ago, we did not have a good relationship with our rotation sites. So I started small, and our goal was to get maybe 10 pharmacies on board.
I definitely have learned technology is your friend. You get used to kind of teaching the same way, doing the same thing. But when something like this hit and I realized we're not going to be in the lab every day doing skills like we normally are, it really made me dig deep down and say, how are we going to do these skills if they're not in the lab? But it worked. We learned technology. I watched numerous hours of content online. I went to workshops online, and I really learned how to use technology and make it fun for my students.
Is it the right time to start a program? Not only is it the right time, but is it the right time and the right program for your student? Do you have the population of students that would be interested enough to roll out a new program, because it is quite a bit of work? And in the community, is there the need? Is the community wanting more phlebotomy? So is it the right time to start a program? You really need to look at what type of program are you going to be starting? Do you have the right student for the right program? And do you have the community resources and the community need to place those students into employment? So all those factors are important so that the program is successful and that you're able to get a student into the program, educate them well, train them well, have community commitment and partnership, and then be able to put that student out to work.
What we've really done that's been the most effective for us is to think about Stephen Covey's 7 Habits of Highly Effective People and start with the end in mind. We go out before we start a program and we bring in 3 or 4 of the biggest employers in the area. We meet with them quarterly and we ask them, what does an entry-level workforce at your agency look like? And then we tailor make our program to have our graduates precisely meet the needs of that hiring agency. So our students get hired at a higher rate and are generally more productive and have a higher retention rate. For us, it's the short-term credential that the employers are asking for. It really doesn't matter that we can say a student was in a program for 2 years learning healthcare. That credential from NHA that shows this student is a certified phlebotomist or a certified EKG technician or certified patient care tech, that's what matters to employers. So for me, I would stress that it's not so much the process, but the outcome that really lasts and has the biggest impact on employment. I mean, for me, what we're trying to do is get our young people, get our schools to not think about high school as walking across the stage and getting a diploma. For us, high school is about what are you going to do after you walk across that stage? What is life after high school? And it's got to be an appropriate, successful post-secondary placement. Now, whether they matriculate to a 2-year college or a 4-year college or get a job, all of those options are okay. But especially with dropouts, if their high school education doesn't end with a job that pays a sustainable living wage, then what are we really doing in career tech? That, I think, is the most important thing for anybody to remember as they set up a program. You can have the best classrooms and the cleanest hallways and all that. But if that student is not prepared with not only the hard skills, but the soft skills to be able to keep a job, then you're really not doing what you're responsible to do, what you're charged to do, and what you really should be a good steward of that child's life.